Hey friends, welcome back to the channel. If you're new here, my name is Neil Brian Galve, and this is NurseBrain. And I need to start this video with a statistics that absolutely shocked me when I first learned it. Every year, dengue fever infects up to 400 million people worldwide and kills around 25,000 people. That's roughly 68 people dying every single day from a disease that most people in wealthy countries have never even heard of. But here's what really got my attention. Dengue is called breakbone fever for a reason. And if you think about COVID was bad, wait until you hear what dengue actually does to your body. And the scariest part? It's spreading faster than almost any other disease on the planet. So, in this video, I'm going to break down everything you need to know about dengue. What it actually is beyond just a tropical disease, why cases are exploding globally and reaching places they've never been before, what's happening in countries like the Philippines, and where dengue is a genuine public health emergency. And most importantly, what this means for global health and why, even if you live somewhere dengue doesn't exist yet, you should absolutely care about this. Now, I want to be upfront. I'm not a medical doctor or an epidemiologist, but I've spent weeks diving deep into the research on this topic because the more I learned about dengue, the more I realized this is one of the most underreported health crises happening right now. And by the end of this video, you're going to understand why public health experts are genuinely terrified about dengue, and why some researchers think we're on the verge of a global dengue pandemic that could make COVID look manageable by comparison. But first, let me give you some context. Dengue is endemic in over 100 countries. The 5-year average shows 185,008 cases annually with 732 deaths, but those numbers are exploding. We're talking about a disease that's spreading to new countries every year, and climate change is making it worse. Let me start by completely changing how you think about dengue, because most people's understanding of it is stuck in its just a tropical flu category, and that understanding is dangerously wrong. Dengue is caused by a virus that's transmitted by Aedes aegypti and Aedes albopictus mosquitoes. These are day-biting mosquitoes, which means you can't just avoid them by staying inside at night like you can with malaria mosquitoes. These mosquitoes are active during the day. They're aggressive, and they love urban environments. But here's where dengue gets really scary. There are actually 4 different serotypes of dengue virus: Dengue 1, Dengue 2, Dengue 3, and Dengue 4. And here's the kicker. Your first infection with one serotype usually isn't that bad. You might get fever, headache, muscle pain, hence the name breakbone fever, because it feels like your bones are breaking. But most people recover. But it's the second infection that can kill you. When you get infected with a different serotype the second time, your immune system can actually make things worse through something called antibody-dependent enhancement. Basically, the antibodies from your first infection try to help, but they end up making it easier for the virus to infect your cells. This can lead to severe dengue, which used to be called dengue hemorrhagic fever. We're talking about plasma leakage, where fluid leaks out of your blood vessels, severe bleeding, organ failure, dengue shock syndrome, where your blood pressure drops so low that your organs start shutting down. And here's where it really got me. There's no specific treatment for dengue, no antiviral drugs, no cure. The only treatment is supportive care, basically keeping you alive while your body tries to fight off the virus. That's why the case fatality rate, even with good medical care, can be 2 to 5% for severe dengue. The reason I'm spending so much time on this is because when people understand what dengue actually does to your body, the conversation about prevention in global health becomes very different. Now, here's where this story gets really concerning. and it's something that should worry everyone, not just people living in tropical countries. Dengue cases have increased dramatically over the past few decades. We're talking about an eightfold increase globally since 2000. In 2019, we saw the highest number of dengue cases ever reported, over 5.2 million cases. But 2023 broke that record with over 6.5 million cases and more than 7,300 deaths. But here's what's really alarming. Dengue is spreading to places it's never been before. We're seeing local transmission in Europe, in parts of the United States, in areas that were previously too cold for Aedes mosquitoes to survive. And this isn't random. There are specific factors driving this explosion, and understanding them is crucial because they're not going away. They're getting worse. First, climate change. The Aedes mosquitoes that carry dengue thrive in warm, humid conditions. As global temperatures rise and weather patterns change, these mosquitoes are expanding their range. Areas that were previously too cold are now perfect breeding grounds. Second, urbanization. These mosquitoes love urban environments. They breed in small containers of standing water, flower pots, water storage containers, discarded tires, anything that could hold water for a few days. As more people move to cities, especially in developing countries, we're creating perfect conditions for dengue transmission. Third, increased travel and trade. An infected person can travel from a dengue endemic area to a non-endemic area while they're still infectious. If there are Aedes mosquitoes in that new location, they can start a local outbreak. And fourth, the El Niño phenomenon in 2023 created a perfect conditions for dengue transmission. Higher temperatures increase rainfall and humidity, all of which help mosquito populations explode. But here's what's really concerning about this global spread. Once dengue establishes itself in a new area, it's incredibly difficult to eliminate. The mosquitoes adapt to local conditions. The virus circulates in the population, and you end up with endemic transmission. Let me tell you about what's happening in the Philippines right now, because it's a perfect example of how dengue can overwhelm even prepared healthcare systems. The Philippines reports some of the highest dengue case numbers in the world. We're talking about tens of thousands of cases every year, with hundreds of deaths. But what makes the Philippines situation particularly tragic is that much of this was preventable. Here's what happened. There was a dengue vaccine called Devastation that was introduced in the Philippines in 2016. It was supposed to be a dengue changer, but then it was discovered that the vaccine could actually make dengue worse in people who hadn't been previously infected with dengue. The same antibody-dependent enhancement I mentioned earlier. The vaccine was suspended. There was a massive public health scandal, and vaccine confidence in the Philippines plummeted. Not just for dengue vaccines, but for all vaccines. Parents started refusing routine childhood vaccinations, which led to outbreaks of other preventable diseases like measles. But the dengue problem didn't go away. In fact, it got worse. The Philippines now has one of the highest dengue burdens in the world, with the disease being endemic across the entire archipelago. What's happening on the ground is heartbreaking. During dengue season, typically the rainy months from June to November, hospitals become overwhelmed. Pediatric wards fill up with children suffering from severe dengue. Families spend their life savings on medical care. Some children die because there simply aren't enough hospital beds or medical resources. The government has implemented various control measures, the 4S strategy. They call it Search and Destroy Mosquito Breeding Sites, Seek Early Consultation, Self-Protection Measures, and say yes to fogging only during outbreaks. But it's an uphill battle. What really struck me about the Philippines situation is how dengue affects not just individual health, but entire communities. Schools close during outbreaks. Economic activity slows down. Families are torn apart by medical expenses and the trauma of losing children to preventable disease. And here's the really concerning part. The Philippines isn't unique. Similar patterns are playing out across Southeast Asia, Latin America, and increasingly in other parts of the world. Now, let me explain something that most people don't understand about dengue, and it's crucial for recognizing when someone needs emergency medical care. Dengue infection happens in three distinct phases, and understanding these phases can literally be the difference between life and death. The first phase is a febrile phase, which usually lasts 2 to 7 days. This is when you have high fever, we're talking about 40 degrees Celsius or 104 degrees Fahrenheit, along with severe headache, pain behind the eyes, muscles and joint pain, nausea and vomiting. You might also see mild bleeding like nosebleeds or bleeding gums. Most people think this is the worst part, but it's actually not. The fever and pain are miserable, but this phase is rarely life-threatening. The second phase is the critical phase, and this is where dengue becomes dangerous. This happens around days 3 to 7 of illness, usually when the fever starts to come down. This is called defervescent, when your body temperature drops to almost normal. Here's the counterintuitive part. When the fever breaks, that's when you need to be most worried. During this phase, some patients will improve and recover completely, but others will develop warning signs that indicate they're progressing to severe dengue. The warning signs include severe abdominal pain, persistent vomiting, signs of fluid accumulation like difficulty breathing, bleeding from the gums or nose, restlessness or lethargy, and liver enlargement. Blood tests might show increasing hematocrit and decreasing platelet count. If someone develops these warning signs, they need immediate medical attention. This is when severe dengue can develop. Dengue shock syndrome, severe bleeding, or severe organ impairment. Without proper medical care, the case fatality rate can be 10 to 20%. With good medical care, it drops to less than 1%. The third phase is recovery phase, which happens 48 to 72 hours after the critical phase. Body fluids return to normal, the patient's general well-being improves, and you might see a characteristic rash that looks like islands of white in a sea of red. The reason why I'm explaining this in detail is because recognizing these phases, especially the critical phase, is crucial. Many dengue deaths happen because people think the worst is over when the fever breaks, but that's actually when the most dangerous complications can occur. Now, let's talk about prevention, because this is where the science is clear but the implementation is incredibly challenging. The primary prevention strategy for dengue is vector control, basically controlling the mosquito population. The enhanced 4S strategy I mentioned earlier is the current approach. Search and destroy breeding sites, seek early consultation, self-protection measures, and say yes to fogging only during outbreaks. But here's the problem. These strategies require massive community participation and sustained effort, and they're incredibly difficult to implement effectively at a scale. Let me give you an example of how challenging this is. Aedes mosquitoes can breed in incredibly small amounts of water. We're talking about bottle caps, plant saucers, clogged gutters, anything that could hold water for just a few days. A single household might have dozens of potential breeding sites. Now, multiply that by millions of households in a city, and how you start to understand the scale of the problem. You need every single household to consistently eliminate breeding sites, and you need to do this continuously, not just during outbreak seasons. The self-protection measures include using mosquito repellents, wearing long-sleeved clothing, using bed nets during daytime rest, and installing window screens. But again, this requires consistent behavior change across entire populations. Fogging, spraying insecticides to kill adult mosquitoes, is often used during outbreaks, but it's not very effective as a long-term strategy. It only kills mosquitoes that are flying around at the time of spraying, and the effect is temporary. There have been some innovative approaches. In some countries, they're releasing genetically modified mosquitoes that can't produce effectively. Others are using mosquitoes infected with Wolbachia bacteria, which reduces their ability to carry dengue virus. But here's the reality. Despite decades of vector control efforts, dengue continues to spread. The mosquito are incredibly adaptable, and the social and environmental factors that favor dengue transmissions are getting stronger, not weaker. This is why there's been so much focus on developing dengue vaccines. But as the Philippines experience shows, that's incredibly challenging too, because of the unique immunology of dengue. So, let's zoom out and think about what the dengue crisis means for global health, because the implications go far beyond just this one disease. First, dengue is a perfect example of how climate change is reshaping global health. As temperature rises, weather patterns change. We're going to see more vector-borne diseases spreading to new areas. Dengue is just the beginning. We could see similar patterns with chikungunya, Zika, yellow fever, and other mosquito-borne diseases. Second, dengue shows us how urbanization and global connectivity can accelerate disease spread. The same factors that have lifted billions of people out of poverty, cities, trade, travel, also create perfect conditions for disease transmission. Third, the dengue crisis highlights massive inequalities in global health. The countries with the highest dengue burden are often the ones with the least resources to deal with it. We're talking about diseases that disproportionately affect the poor, while the healthy countries that could help develop solutions have little incentive to do so because they're not directly affected. But here's why everyone should care about dengue, even if you live somewhere it doesn't currently exist. Diseases don't respect borders. Climate change is expanding the range of dengue-carrying mosquitoes. We're already seeing local transmission in parts of Europe and North America. Moreover, dengue is a perfect example of how global health challenges require global solutions. The research and development needed to create better vaccines, treatments, and control strategies requires international cooperation and funding. There's also an economic argument. The global cost of dengue is estimated at $8.9 billion annually. That includes direct medical costs, but also lost productivity, tourism impacts, and the broader economic effects of outbreaks. But perhaps most importantly, dengue represents a failure of your current approach to global health. We have the scientific knowledge to control dengue. We understand the biology of the virus and the mosquito. We know what prevention strategies work, but we haven't been able to implement these solutions at the scale needed to make a real difference. This suggests that we need fundamentally different approaches, not just better science, but better ways of organizing global health responses, funding prevention efforts, and addressing the social and environmental factors that drive disease emergence. So here's what I want you to take away from this video. First, dengue is not just a tropical disease that affects other people. It's a global health crisis that's getting worse, and it's spreading to new areas every year. Second, dengue shows us how complex global health challenges really are. It's not just about medicine, it's about climate, urbanization, poverty, inequality, and international cooperation. Third, the second infection paradox with dengue teaches us that our immune systems are incredibly complex and that developing vaccines and treatments for some diseases is much harder than we might expect. And finally, dengue is a preview of the kinds of health challenges we're going to face more and more as climate change accelerates and the world becomes more connected. If you found this video helpful, I'd love it if you could give it a thumbs up. And if you want to learn more about global health and how diseases spread, definitely subscribe to the channel. Thank you so much for watching, and I'll see you on the next video. Once again, this is NurseBrain, inspiring greatness one lesson at a time.